Before we begin the scrub, we need to understand the importance and principles of the surgical scrub and aseptic technique. Aseptic technique is when all pathogenic microorganisms are killed, with the exception of non-pathogenic microorganisms on inanimate objects. The surgical scrub technique is an application of the standard precautions used in a healthcare environment for infection prevention and control. The purpose of the surgical scrub technique is to prevent the transmission of pathogenic microorganisms between the patient and the healthcare personnel. Everything shown up until this point is an example of everything you should not be doing, as this is unsterile and unsafe. Prior to the scrub, you need to ensure necessary supplies are set up and prepared by the circulator. These items must be decontaminated to ensure they are rendered safe for its intended use. These supplies include greens, which is also known as a scrub suit, which contains the hairnet or cap, goggles, gown, mask, gloves, shoe covers, and hot towel. The scrub must be freshly laundered, have maximum skin coverage, should be close fitting, should cover all hair including facial hair, as well as clean, non-static, and free of lint. Remember, if the scrub suit becomes visibly soiled or wet, it needs to be changed. The surgical gowns are to be folded with the insides facing outward, and only sterile surfaces should contact sterile surfaces. Other important steps to note before beginning the scrub technique: ensure nails are kept short and clean, all jewelry is removed, hair is tied back, and the scrub shirt is tucked into the pants. Before the pre-wash, sanitize or wash your hands and put on the following items. Always ensure your cap is on before donning the scrub suit. Ensure no hair is sticking out and the cap covers your ears. To put on a mask, always handle the mask by the strings and put them behind your ears. It is important to ensure the strings are never crossed, the metal nosepiece is formed to the face, and the bottom of the mask covers the chin. Ensure there are no gaps for air to enter or escape. Next, the shoe covers must be put on. The chevron or adhesive tab should be on the outside of the shoe, and then follow by sanitizing your hands afterwards. Now we are ready to perform the pre-wash. First, you must prepare the scrub brush. Turn on the water, and if available, adjust to a warm temperature. Wet hands and forearms from elbows to fingertips. Apply about 5 milliliters of antimicrobial soap to your hands, and then perform a basic hand wash from fingertips to elbows, and lather soap for at least 30 seconds. Once completed, perform a final rinse from fingertips to elbows. Remember to keep hands away from elbows and body at all times, and do not touch the sink. Using the orange stick, remove debris from under all nails of both hands. Ensure this is done under running water. Once completed, discard the orange stick in the sharps container. Now we are ready to begin the surgical scrub technique. Wet the scrub brush to ensure adequate lather during the scrub. Remember to use the counter brushstroke method, where one brushstroke is one up and down motion. When rinsing, it is important to ensure the flow of water runs in one direction from fingertips to elbow. For this demonstration, we will be showing one stroke per plane. Using the abrasive side of the scrub, put all fingertips of one hand together and scrub all nail tips and cuticles as one unit for 30 strokes. Using this hand and scrub fingers, remember each finger is divided into 4 planes. Each web space counts as an individual plane, for 10 strokes per plane. Of the same hand used, scrub the hand, which is divided into 4 planes, with 10 strokes per plane. Next, scrub the same arm up to 2 inches above the elbow. The arm is divided into 2 sections, with the first section as wrist to mid-forearm, and the second section is mid-forearm to 2 inches above the elbow. Each section is divided into 4 planes with 10 strokes per plane. Once this hand is completed, transfer the scrub brush to the scrubbed hand and begin to scrub the opposite extremity. With the same surgical scrub technique and counted brushstroke method as demonstrated previously, Ensure to include all nail tips, cuticles, fingers, web spaces, hand, forearm, and elbow, and apply the respective number of strokes per plane. Once both hands are completed, discard the scrub brush. Perform a final rinse, keeping your hands in front of you and above the level of the elbow. It is important to remember that the water should flow from fingertips to elbow in one direction. Once the surgical scrub technique is completed, always ensure that your hands and arms are in your visual field to ensure there is no cross-contamination while donning the gown and gloves. Turn off the tap using either your knee or foot or anything below your waist is considered unsterile. Now you must dry your hands and arms using the sterile green towel, also known as the hug towel. With the folded end pointing towards you, pick up the towel using one hand and step back from the scrub table. Start to dry the other extremity beginning from fingertips to elbow and use a dabbing or patting method. Using the sterile transfer technique for the hug towel, grab the bottom of the opposite side of the towel and flip it upwards. Now, dry the other extremity beginning from fingertips to elbow and use the same dabbing or patting method. Discard the hug towel in the proper container. Now we are prepared to don the gown. As prepared by the circulator, the inside of the gown should be open for you to grab. Do not grab the gown at the neckline. Insert your arms into the sleeves and ensure your fingertips do not become exposed, and ensure they stay within the sleeves. The circulator will tie the top back strings without breaking the sterile field. Remember, the unsterile field is anything below the waist, behind the scrub personnel, and above the axillary line. The circulator will now dispense the sterile gloves into the sterile scrub table. The circulator should never lean over or reach over this table. With your hands still within the sleeves, unwrap the gloves. Using your dominant hand, use the close gloving technique to put the glove on the non-dominant hand first. It is important to remember while using the closed glove technique to ensure no skin is exposed, as this creates the risk of contamination. Then, this is repeated for the dominant hand. Using the sterile glove paper, wrap the front gown strings to pass to the circulator, who will then tie the remaining gown strings in the back. When passing the wrapper and string to the circulator, do not make contact with the circulator, as they are considered unsterile. If in any case you need to pass another sterile personnel, ensure you pass back to back or front to front. Now, you have completed a pre-wash, surgical scrub technique, donning the gown and gloves, and now you're ready to save lives.